Hi, thanks for coming back. In this next video, what we're going to be providing some information about is actually how to open up the lats, the serratus, the ribs, anterior ribs just a little bit, and all through just another positional breathing exercise. So basically what we're looking at here is we're actually trying to facilitate a little bit more movement of the scapula coming in this downward rotation around the rib cage, right? So if you've got the ribs here, the scapular sit a little bit convex on top of the back of the ribs, right? And so their function is to kind of downwardly rotate and come around the ribs, right, as we start to lift our arms up. So as I start to lift my arm up this way, right, the scapula starts to come around and wrap around the rib cage there. And so what we're going to do is we're going to facilitate this position by just resting our elbows up on top of a table here. And this chair is actually a little bit high, so I'm gonna lower it down just a little bit, okay? Because I want to be about sternum height against the surface that I'm on here. Okay, so I'm gonna get my elbows down on the table here. And what this does is this actually puts me into a little bit of extension in through my spine. So, but what I want to do is fight this extension of my spine just a little bit to facilitate the position. So I'm going to get my elbows up here. I'm going to arch my back. And then I'm going to slowly start to tuck my pelvis. All right. So you're trying to activate the lower abs here. So we're trying to round through the lower abdominals and really find a little bit of rounding in the low back here. This is typically where a lot of people have some pain points, especially in this deep, deep flexion of the low lumbar spine. It's not a huge movement. The low lumbar doesn't really flex a deep amount, but it does move, should move. And we actually want to try to practice that a little bit more because the more the spine moves, especially near the sacrum, the better most low back pain becomes. Okay, so now that we've got this position here, I'm a little bit tucked, and I'll get a shot of that. A little bit tucked of that position. Now my low back is rounded, but my upper back is up, and that's what I'm looking for, right? I'm looking for this extension of my upper thoracic spine. Right. So you want to feel your abdominals engaged. So low abs, mid abs, upper abs. So you're flexing everything forward like you're trying to do a sit-up, but at the same time, you're lifting that chest up just a little bit. Now notice I'm not flaring the ribs because I actually want to keep those down and pinned towards the back of my spine. I want to flex my abs so that I'm in a flexed position. Once I've got that engaged, now I've got my elbows on the table. I've got this little bit of extension here. Now I'm going to facilitate this a little bit more by thinking about pushing my sternum straight ahead and then slowly sinking down. Now in order to get a little bit deeper into the space, I'm going to start to flex my biceps by pulling my hands towards my shoulders. This increases more stretch through the triceps, right? Because we're pulling the triceps along by flexing the biceps. And now I've got a pretty good stretch through the middle of my rib cage on the posterior side. So the lat, the serratus, I'm pulling my scapula apart a little bit here. And now I'm just going to do one little thing here. I'm going to slide my chair back just a little bit so I just sink down a hair more. I'm actively pulling my hands towards my shoulders to lengthen through those triceps. And now I'm going to get those 5 good deep breaths. So once again, through the back of the nose. And out. Feeling those abs engage all the way as you exhale. Push all that air out. And in. Still squeezing my biceps to pull my hands towards my shoulders. Exhale. And in. Holding those abs. Give them one more good deep breath. Think about trying to lift that sternum up just a little bit more. And out. All the way, hold the space, hold the squeezes. Take a normal breath in and relaxing the tissue. and out. Just holding in that space for just a second. And then coming up very slow, untucking that pelvis, feeling that spine start to extend up, lifting the elbows off the table and gently let those arms fall down here. And once again, kind of sitting up, rolling those shoulder heads back by pulling those elbows forward, and then just letting the arms hang, and just take a couple deep breaths to let the body, once again, figure out what just happened, let it map it out. The nervous system's pinging everything, being like, what was that? What just happened? Give it some time to kind of figure it out through some calm, deep breaths, and let it become normalized. So now when I was doing that, I could feel a good solid stretch all the way through here on both sides, more so on my left than on my right. Now, for me, I need to open up my right side just a little bit more, and so I definitely want to be kind of side bending into my left a little bit, and then also really focusing on trying to engage through the left side oblique and abdominals and QL to get myself just a little bit more onto that right side so I can open up, or that left side so I can open up my right side just a little bit more. And as we go on in other videos, we'll talk about how this works with the dominance between right and left sides, and how our dominant side typically is a tighter side. Even though we feel the pain on the non-dominant side, that is usually because the dominant side is so overused and so overdeveloped that the non-dominant side is now weak and long, and the dominant side is strong and short, which actually is the problem. All right, I hope you find this useful. Thank you. If you like this content, once again, like and subscribe, and we'll see you next time.